I was first interested in medicine when I was a little kid. My hometown pediatrician was my favorite human being on the planet. There are stories, I don't remember them, I was very young, that I would take her stethoscope and follow her around in the office. I just thought, what an amazing thing that this woman does, taking care of kids and helping them feel better. And she did it in this incredibly elegant way. And so when I realized that medicine was the thing, it was the thing that I wanted to do, there was really no other choice than to come back home to IU. I interviewed, early decision, got that letter in, and my fate was sealed. I joke that I keep trying to leave Indiana and IU, and I never have. There's always something in the backyard that's the next thing that makes a difference in people's lives. And every time you turn around, the School of Medicine is always at the forefront in making that thing happen.
So Jen deserves this award because she is a committed public servant. As a physician, I know that she could be doing a million other things, but she's chosen to serve the state and to serve Hoosiers and help ensure that Indiana's on the right track to really focus on health equity and individual healthcare needs. And so for that reason, because she's compelled by that mission and comes to work daily, affects so many individuals, I can't think of a better person to receive this award. She brings an energy that is unparalleled. I mean, it is a natural, I would say, kind of evidence-based experience with her. She still works in the ER, so she'll come in on Wednesday mornings with a very concrete example of where our safety net programs may be where she found some gaps or where we're doing well. And so every fiber of her being, and which plays out within the agency, is how can we serve people better? How do we improve our safety net? How do we encourage health equity and really transform our services? So she just brings a just tremendous amount of passion and focus, and she's there's a lot of teaching in what she does, and it's a very natural and unassuming. You don't know it, but you spend a little bit of time with her, and you're a better person for it.
I'd like to accomplish in this career a couple of things. One, I love being a doctor, and I want to make sure that when I walk out of every single shift, that the people that I work with and the people that I took care of knew that they had somebody who was really invested in their health, invested in their care. And secondly, I would like to make sure that the work that we do is not just a pet project, but that when I'm not here anymore and no one remembers who I am, that the legacy that we left behind is that we deliver excellent, compassionate services that impact people in ways that they really don't even understand, and that we've driven health outcomes to put Indiana on the map, not as the bottom of the quartile, but at the top. This award is really extraordinary. I didn't know that I had been nominated, and so the call was incredible. And I thought, when I came here back in 1996, this was not on the list. The list was finish. Just the idea of coming from a small town and then going off to school and then coming back to medical school without a whole lot of folks in your life in medicine. I just wanted to get it done. I wanted to be good at it. But the idea of being good at it and then someone saying, "Hey, you did a good job and you're making an impact." That's not the reason that you do the work, but it sure doesn't hurt.